Hello, everyone. My name's Karen, and I'm one of the nurses from Cardiac Rehab. I'm also a nurse practitioner student, and in today's lecture, we're going to talk about the appropriate use of medications. So, thank you so much for joining me today as we dive into this critical aspect of your cardiac rehab journey. In this presentation, we're going to explore the importance of medications in managing cardiovascular health. We're also going to discuss some common medications that you may encounter and empower you with that knowledge needed to make informed decisions about your medication regimen. So let's start. So these are the contents of the presentation. We'll be discussing some key things that you need to know about medications, especially with newly prescribed meds. We're also going to go over some basic principles on how to read a prescription label. We'll discuss proper medication storage and disposal. And we're also going to go over some common heart medications that you may encounter. We'll learn some tips to help you remember to take your prescriptions and not miss dosages. And lastly, we'll briefly talk about using alcohol and recreational drugs in the context of possible reactions with prescriptions. All right, so these are the key things that you need to know, especially when prescribed a new medication. Some common questions that you need to be familiar with are the what, why, when, and how much for your prescription medications. So, first, you need to be familiar with the name of your medication. And when I say name, know both the generic and the trade name or the brand name if possible. Second, you need to know what the medication is for. Why was it prescribed for you in the first place? Also, how often should you take the medicine? Is it a medicine that should be taken on an empty stomach? Is it supposed to be taken twice a day or once a day? Now, it's also important to learn the expected side effects of the medicine. We'll go over some common heart medications later in the lecture and describe the common adverse effects of medicines. And also, one other thing that you need to ask your prescriber, what do you do if you miss a dose? Can I take an extra dosage now, or should I just skip it for the day and then take my usual dose tomorrow? And what if I don't finish the medicine and somehow it becomes expired? How do I properly dispose the medicine? How do I store it? Make sure you ask these questions when you're prescribed new medications. So, these are some key things on the prescription label that you need to remember and pay attention to. I'm going to go over some of these things here. Some of them are pretty self explanatory, but I just want to point out a few things that are very important to remember and make sure that you're aware of before you leave the pharmacy. So, first on A, you need to make sure that your name and address are listed correctly. So, it's important to make sure that this information is correct before leaving the pharmacy, number one. On B, you also need to make sure that the name of the medicine is correct. Usually, the generic and brand name of the medicine is listed. Um, it would also list the strength and the formulation. For example, could be a tablet or a capsule. That's usually listed in the same line. On C, you'll also be given directions. So the prescriber will provide information about how the medicine should be taken. The instructions will be put on the label so you know how much to take. For example, how many tablets? Is it just one tablet or do you need to take two tablets? How often should you take it? And sometimes, what time of the day should you take it? Is it supposed to be taken in the morning or should you take it right before you go to bed? The medicines that come in different formulations, such as liquids, creams, or injections, will have specific instructions on how they should be used. On D, you'll see the name of the prescriber. So that could be your doctor, your nurse practitioner, your physician assistant. On E, you'll see some warnings or special instructions. So that information often includes common side effects of the medicine and special instructions such as to take it with food or avoid the sun after taking this medication. On F, you'll see refills, and sometimes the prescriber will order refills for the medicine. So the number of times that the medicine can be refilled will be included on that label. However, just take a note that some medicines, like antibiotics, actually do not include any refills. On G, you'll see the discard date, and that's the date the medicine will expire. So if all the medicine is not used by that date, it should be discarded. H, that's the manufacturer information and national drug code. On I, you should see the description of the tablet or the capsule. That would be at the very bottom corner on the right side. Most pharmacy labels usually will provide a description of what the medicine looks like. For example, it can indicate the color or the shape of the medicine. On J, you'll see the quantity, so that would be the number of tablets or capsules in the container. On K, on the top corner there, you'll see the date. So that's the date that the original prescription was filled. So if you had a prescription refilled, the date that was refilled will also be listed there. L, that would be the DEA number for the pharmacy. On M, that would be the name of the pharmacist. And N, that would be name, location, and telephone of the pharmacy. And O, so your prescription number. And remember that every prescription is given a unique number. Okay. All right. So proper medication storage. Remember that where you store your medicine can affect how well it works. So it's important to learn how to store your medications properly to keep them from getting damaged. Know that heat, air, light, and moisture may damage your medicine. So you want to store your medicines in a cool, dry place. For example, you can store it in your dresser drawer or a kitchen cabinet. Make sure they're away from the stove, your sink, or any hot appliances. If you are like most people, you probably store your medicine in the bathroom cabinet. However, take note that heat and moisture from the shower, the bath, and the sink that can actually damage the medicine. Your medicines can become less potent or they may go bad before the actual expiration date. Also, if you can, always keep the medicine in the original container. It's very important to be able to distinguish what kind of medicine they are and to actually know when they're going to expire. It's also important to keep the children safe and make sure that the medicines are out of their sight and out of their reach, especially for very small kids. Also, damaged medicine will make you sick, so do not take medicines that has changed in color, texture, or smell, even if it has not expired yet. So check the expiration date on your medicine and throw out the medicines that are out of date. Skip a slide. So, how do we properly dispose of expired or unused medications? And this is a common question that I receive from a lot of people, friends, family, other patients, family members. And the best way to dispose of your expired or unwanted or unused medications is actually through a drug take back program. Now, the US Drug Enforcement Administration, or the DEA, they sponsor something called a National Prescription Drug Take Back Day in communities all over the country. So many communities also have their own drug take back programs. You may use the DEA website and the California Department of Consumer Affairs, or the DCA website, to find permanent collection site near you. And I'm going to show you a screenshot of the DCA webpage in the next slide, actually. So if there are no collection locations near you, however, you may also dispose them in household trash. However, okay, big however, make sure to take out the drugs out of their original container and mix them with either cat litter or soil. If you mix them with coffee grounds, make sure you do not dispose them in compost. So after you mix them with either the cat litter or soil, something undesirable, you want to put this mixture in a Ziploc or another container that you can close so it doesn't leak, and then you put them in the trash. If that container has any of your personal information or the name of that medication, make sure it's scratched off. And also another very common question that I receive is that, can I flush my own medications down the toilet? Does anyone know the answer? So the answer is actually it depends. Now, there is an FDA flush list for certain medicines. These medicines are on the medicines are on the flush list usually are those that number one, they're sought after for their misuse or abuse potential. Number two, they can possibly result in death, even just from one dose if inappropriately taken, especially for small children. So make sure that you check the FDA website before you discard any of your medications down the toilet. Okay? All right, so this slide shows you a screenshot of the California Department of Consumer Affairs webpage. And on the search bar, you can just type the name of the city, the zip code, or even the pharmacy name. And once you click search, it actually gives you a list of collection receptacles that are registered with the Board of Pharmacy. On Google, you can just write California DCA drug take back program. Usually, the first result would be the California DCA webpage that will take you to the screen. And if you have any questions about this, I'll be happy to give you the website when I see you in class. Also, there is a DA on the DA website. You can also look for lists of receptacles there as well. All right, now we're going to go over some medications. And I know that this slide is overwhelming, but I just want to show you a list of the different classes of heart medications. And this is actually not an all inclusive list, but just want to point out that there's a lot of different heart medications. So we're going to go over some of the drug classes and give you some examples. Just try to be familiar with the ones that are actually prescribed for you. We're also going to discuss their primary indications as well as common adverse effects. All right, we're going to start with anticoagulants. And these are commonly referred to as blood thinners, although they do not actually thin your blood. They do not dissolve existing blood clots. What they do is they work by decreasing the actual clotting or coagulating ability of the blood. So, what are the common reasons that this medication is prescribed? Usually, it's prescribed to help prevent harmful clots from forming in the blood vessels and can also help prevent clots from becoming larger and causing more serious problems. They're also often prescribed to prevent first or recurrent stroke. Common examples include apixaban or Eliquis. We have heparin, and I put various on the brackets there because there are multiple different formulations of heparin. It can be given either subcutaneously, so in the fatty tissue of the body, or it can be given IV. So you'll probably see that IV bag in the hospital. Another example that's very common is warfarin, and the brand name is Coumadin. Also, just want to point out that for all the medication examples, I will be providing both the generic and the common trade names. So, what are the adverse effects for anticoagulants? That would be bleeding and easy bruising. And then it's very similar to our next slide here. We have the antiplatelets. So, like I said, this class of medication is very similar to anticoagulants and can also cause easy bruising and bleeding. Both anticoagulants and antiplatelets, they reduce or prevent clotting, but they work in different ways. So instead of decreasing the clotting ability of the heart, antiplatelets actually prevent platelets from sticking together, and that decreases your body's ability to form blood clots. Common examples are aspirin. We have clopidogrel or Plavix, usually given for patients with stents. There's also prasugrel or Effient and ticagrelor or Brilinta. So these are usually prescribed for patients who have had a heart attack, like I said, stent placement, maybe atrial fibrillation, or ischemic strokes, for example. They can also be prescribed preventively when plaque buildup is evident, but there's not yet a major blockage in the artery. And just off note, certain patients will be prescribed aspirin combined with another antiplatelet drug. This is also known as dual antiplatelet therapy or DAPT. So that's beyond the scope of this lecture, but I just want to point that out that there are certain cases that two antiplatelets may be prescribed for the same patient. All right, so now we're going to move on to blood pressure medications. We're going to start with some ACE inhibitors. These are very common medications, and they lower the blood pressure by expanding the blood vessels and decreasing resistance. So, because there's a smaller resistance that allows for blood to actually flow more easily and makes the heart work easier or more efficient, so they are usually prescribed to manage high blood pressure and heart failure. Now, if you know this, all of the medications actually end in a PRIL or a PRIL. So, common examples we have lisinopril, that's probably the most common one that I see for the majority of patients. Also, captopril and ramipril. Now, one common side effect is coughing. And remember that this is not an allergic reaction. Rather, it is a common adverse effect to the medicine. Okay. Next, we have angiotensin 2 receptor blockers or ARBs. Now, this medicine works in the same pathway as the ACE inhibitors, so they should not be taken together. If you see both an ACE inhibitor, remember those medicines that end in april. Let me just go back real quick. If you see these medicines that end in april and these medicines that end in a sartan, these are ARBs, and you see them on your current medication list, you have to discuss that with your provider. Like I said, the meds usually end in an SARTAN or sartan, so they're also used for high blood pressure management and for heart failure. Common examples of these medications we have losartan and valsartan. Those are probably the most common ones I see prescribed for patients. And the medication can also cause coughing, but from what we hear from a lot of patients, it doesn't produce coughing as much as ACE inhibitors. All right, next we have calcium channel blockers, and these are used to treat high blood pressure, chest pain, or angina, which is usually caused by reduced blood supply to the heart muscle. It can also be used to treat some arrhythmias or abnormal heart rhythms. So, how does it work? Now, calcium channel blockers, by the name itself, it interrupts the movement of calcium into the cells of the heart and the blood vessels. So, by doing that, it actually decreases the heart's pumping strength and it relaxes the blood vessels. So, it helps to decrease that blood pressure. Common examples of calcium channel blockers include amlodipine or Norvasc. Also, we have diltiazem or cardizem, nifedipine, and verapamil. And some adverse effects include edema, which is swelling, especially in the lower legs and the feet, and also dizziness from that drop in blood pressure. All right. Next, we have vasodilators, and vasodilators also um, helps lower blood pressure by relaxing the blood vessels. And these medications are also used to ease chest pain or angina. And there's a category of vasodilators called nitrates, which I really want to point out here. And they increase the supply of the blood and oxygen to the heart while reducing its workload, which can ease chest pain or angina. There is a picture of that nitroglycerin bottle, that little nitrostat in the middle of the slide here. And this is an emergency medicine, this nitroglycerin. It's available as a pill, and that can be swallowed or absorbed under the tongue. We call it sublingual, basically, when it's absorbed under the tongue. It can also be a spray and as a topical application or a cream. And does anyone know the rule of three for nitroglycerin? So, in the rule of three, especially for that nitrostat bottle here, what we want patients to do when they're experiencing chest pain is that you can take that one tablet of nitrostat. You can take one tablet every 5 minutes as needed for chest pain. However, we do not want you to take anything more than 3 tablets in a 15-minute period. And at that point, we obviously want you to call 911. We also want you to be sitting or laying down immediately after you take this medicine because it can also drop your blood pressure. Common adverse effect headache, dizziness, and nausea. And headache is probably the most common one, especially with nitroglycerin. All right, so ARNIs, we have angiotensin receptor neprilysin inhibitors. They are a combination of a neprilysin inhibitor and an ARB. There is actually only one ARNI that has been approved by the FDA to treat heart failure, and that's called Entresto. It's a first and only ARNI that had been approved, like I said, and this is probably one of the newest drugs that we have in our list. And I thought that this was an important addition to our medication lecture since the latest guidelines actually recommend using Entresto to manage patients with heart failure. And for those who are prescribed with this medication, they have to watch their potassium level because it can cause high potassium. Right, beta blocker. So these medications are very common. They work by decreasing the heart rate and the force of contraction of the heart. So it also lowers the blood pressure. It makes the heart beat more slowly and with less force. Now, this can be prescribed for patients to lower blood pressure, manage abnormal heart rhythms, and chest pain or angina. These medications end in an LOL or OLOL. Common examples include carvedilol, metoprolol, and propranolol. And common adverse effects include fatigue, low heart rate or bradycardia, and low blood pressure or hypotension. All right, and there are various medications that can lower blood cholesterol. However, drugs other than the statins are usually only used for patients in whom statins are not effective or who have serious side effects from using statins. And they work in the body in different ways. Some affect the liver, some work in the intestines, and some interrupt the formation of cholesterol from circulating in the blood. Common examples of cholesterol lowering medications are listed on the slide. We have Lipitor or atorvastatin. That's probably one of the most common ones that we see. We also have Zocor, we have niacin. We also have Vitarin, which is a combination of ezetimibe and simvastatin. Studies also have found that some statins actually work better when taken in the evening, and that's because the liver actually makes most of the cholesterol at night. And off note, some cholesterol lowering medications may interact with grapefruit, so watch out for grapefruit intake, especially when consumed in large quantities. So that includes grapefruit, actual fruit itself, and grapefruit juice. Some adverse effects of this anti-cholesterol medications are upset stomach and muscle pain. All right, diuretics. Diuretics, they cause the body to rid itself of excess fluids and sodium. And how does it do that? It makes you pee a lot. These are commonly prescribed to help reduce swelling or edema from excess buildup of fluid in the body. And they can also help lower blood pressure. Probably the two most common examples here are the furosemide or Lasix and spironolactone or aldactone. Common adverse effects, we have dizziness, headache, and low potassium, especially for certain types of diuretics. All right, we are almost done here. So if forgetting to take your medication is a problem, now these are some suggestions to help you remember. Number one is to make it obvious. So place the medication on maybe your breakfast table or something that you're likely to stumble over it. And, just be careful where you put the medication if children are around. We also put a reminder note on your bathroom mirror or your coffee maker. You can also use a checklist or an organizer. And make sure that your medication chart is up to date. Number three, you can also use an electronic reminder and you can set up an alarm on your smartphone. There's some apps also that you can do that with. And number four, you can also maybe ask some family members to remind you to take your medication at the right times. And also don't let yourself run out of medicines. Remember, most pharmacies, sorry, they offer automatic refills. However, for those who do not have an automatic refill in their pharmacy, when you get your prescription filled, add a reminder to your calendar on the date 1 week before your actual medication will run out, or 2 weeks if you get your medications by mail. You do not want to wait until the last pill is taken to order more. And if you plan to travel, put a note on your luggage reminding you to pack your pills. And always pack them in your carry on luggage. Do not put them in the luggage that you're going to check in. All right, here is our last slide. So just want to note that alcohol and other recreational or even other prescription drugs, they can interact with your new or current medications. So just be aware of that. Some may make your prescriptions become less effective, while some can actually cause a buildup of your prescription medications in the body, and sometimes that can cause harm. Now, in some cases, alcohol or recreational drugs can actually make existing long term conditions worse. Another common question that we see is that we get is, how much alcohol is too much? So, according to the CDC, the recommendation is no more than 2 drinks per day for men and 1 drink per day for women. Now, what does that one alcoholic drink mean? That's actually equivalent to a 12-ounce beer, a 5 ounce of wine, or a 1.5 ounce of a spirit. So remember, that is an or, not an and, either a 12-ounce beer or a wine or a spirit. However, though, always make sure that you consult with your provider. So sometimes avoiding alcohol may be at best depending on certain medical conditions. And examples of that would be cardiomyopathy, heart failure, and certain liver diseases. So that's actually the end of this presentation. I'm sorry, it's a very long presentation, but I hope you learned something new and valuable. These are the references. Thank you so much for listening. And if you have any questions, again, don't hesitate to approach me during one of your exercise classes. Thank you so much and have a good day.